tight hamstrings often come from pelvic instability and not lack of stretching. Your hamstrings are attached here. When they're tight, that means there is a reason why they're tight. It's not lack of stretching it. It's you're doing something that either overworks your hamstrings or puts them in a position where the muscle fibers are stuck in a shortened state. It is an absolute indication of pelvic instability, and that's what this video is all about. Why is there pelvic instability? What do we need to do about it? And how can we make sure it doesn't happen again? Your pelvis is a foundation to the structure above, and your lower extremities are attached to it. When from lifestyle habits, from the choices you make, from injuries you might have had, this, by the way, your lifestyle habits can range anywhere from your work environment to behaviors like even masturbation, the how to. We don't want to get into that yet, not in this video. I've done videos on that, by the way. If you haven't subscribed to my channel, make sure you do and search for it. But the whole point is we want to look at what behaviors are we having that make the pelvis unstable. When it's unstable, anything and everything goes. So when it comes to a tight hamstring, when your hamstring's too short, it is going to pull your pelvis out of alignment. And now that misaligned pelvis, which by the way, is not going to get adjusted by you getting your pelvis adjusted, because that does not solve the reason why it became tight to begin with. It helps short term. So when there is a misalignment and instability of the pelvis, now we open a whole can of worms here. Anything and everything will be dysfunctional as a result of compensation for the shortened muscle fibers. So what needs to happen is we need to go and see what is leading to this, to change it, to remove the things that feed the shortened hamstring, and then go and reverse the process. How do we reverse the process? I use developmental exercises in my practice to address pelvic floor dysfunction and pelvic instability. The reason I do that is because this is the way we first learn to stabilize our pelvis. You see, we were born as babies, we could barely hold our heads up. We all became running toddlers. Well, there are exceptions. We're not talking about exceptions like genetic conditions. We all became running toddlers. You and I and every walking human being on the planet Earth has gone through the process. Without knowing each other, we followed the same steps. Where our brain's hardwired to do it, our body parts are hardwired to do it. This is the manual of movement. I don't need to go reinvent the wheels. I just need to follow the same path that materialized the result that I'm after. Throughout doing these exercises, you are going to notice that there are parts of your body that simply do not perform their job right. This is where the compensation is. You're seeing the result of the compensation, the dysfunctional patterns of movement. My go-to exercises that I absolutely love, granted, there are things you need to do before you get here. I'm going to demonstrate to you. So make sure you subscribe to my channel. I've done, everything's categorized by playlist, everything I haven't held back any information. The goal I have is for you to be educated, so hopefully you can solve your own problems. But back to tight hamstrings. When it comes to tight hamstrings, which is pelvic instability, then what my go-to exercise, what we all did between the ages of 7 months to 12 months, 11 months, and they all start with you being on all fours. So imagine there is biological breathing. If you haven't subscribed to my channel, of course you wouldn't know what that is. So I'll make sure that I put it the link to biological breathing at the end of this, but make sure you subscribe to the channel. So biological breathing is the way you are to breathe. That's step one. There are different steps before you get to do what I'm about to show you. So I'm not going to go through that process because that's not what this video is all about. You go on to quadruped. You're on all four. You're pushing on this little bone at your wrist called pisiform, pushing the ground away, gliding your neck back and up. Your spine's nice and neutral, so your butt's not sticking up and you're not curving. Your hips above your knees and you are slightly behind your wrists. You're breathing biologically, pisiforms pushing into the ground, activating your triceps to send your shoulder blades south towards your back pocket. The next thing is you're gonna push the ground away with your hands and with your ankles or the top of your ankles. You're keeping your spine back and forth, neutral, and pushing it back and forth. This is like a warm-up here. You're breathing biologically. The next thing you want to do is you want to go on your toes and you want to push the ground away with your toes and push the ground away with your hands. You're going to keep your spine neutral, breathing biologically, send your body back and lift your knees up. Now you're going to push forward and backward. You want to keep your spine neutral. You want your legs to send you back and forth and your hands to send you back and forth. The next thing is you're going to go towards the back wall and straighten your knees, keeping your spine neutral. Now I'm going to pump my knees without my body shifting side to side or rotating. My neck is not hanging low. I'm pushing the ground away, keeping my neck along on the same line as the rest of my spine, and I am pumping my knees, activating my legs while my hamstrings being stretched. Now I can return, and that demonstrates what has to be in place. We're not doing downward dog. We're not just cycling our legs. We're stabilizing this trunk so the legs can perform the leg's job without having to worry about the stability of the trunk or having to go in to help. They have their own job to do. Your trunk has its own job to do. The shortened hamstring is an indication that body parts are doing other body parts' job. We need to bring order back into your movement, bring function back into your profile of movement, and this is how you address tight hamstrings, pelvic floor dysfunction, and pelvic instability. I hope this made sense. Stop isolating your body parts and tackling it. Pelvic floor dysfunction is an ultimate result of a series of your dysfunctional movement patterns and a whole bunch of body parts that are just running around doing each other's job. Hope this made sense. Make sure you contact me if you need help using one of the methods of contact in the description box. And until next time, take care.